20 to 40% of patients that have cancer will develop brain metastases.
Metastatic brain cancer is basically a cancer that started someplace else, such as the lung or the breast, for example, and has spread to the brain.
When a patient is told that cancer has spread to the brain, I think it's important to be able to get in touch with people in the know and ask questions regarding what now? What are we going to do next?
We believe here at Rush that in that group of patients, we should be able to answer their questions in a prompt and timely fashion to try to decrease the level of anxiety that the patient and or the family member may have about their situation. In many instances, patients that have brain metastases may have symptoms that may be progressing. One of the problems with the brain itself is that those symptoms, as they progress, they may be irreversible. So you want to try to get the patient treated as soon as possible.
There's no one treatment fits all. Not all patients will benefit from just radiation. Not all patients are going to benefit from surgery. Sometimes there's a combination of both. Sometimes there's one or the other.
We will determine what the plan of action is, not just based on what I think, but what we think will be the best option for the patient.
We are about providing quality of life for the patients. And the reason we can do that so much better nowadays is because we have technology available to us that goes from neuroimaging, the ability to be minimally invasive when we do the microsurgery, the ability to give radiation therapies that pinpoint the tumors and avoid damage to surrounding structures. We are truly at the forefront of the technology that's used nowadays for the treatment of brain metastases. Over the last 15 years, after treating many patients with brain metastases, I've grown to understand what are their anxieties, what is that they need, not only medically, but emotionally.
The thing that makes me the happiest is when I see them in follow-up 6 months, a year later, and they are still able to participate in family occasions, and some of them continue their jobs. And we know that the reason that they are still capable of those things is because we acted promptly.
It's about you getting back to your life, getting back to your family, getting back to your work.